Hey everyone, Dr. Charlie Johnson, physical therapist. On today's video, I want to cover a question that a woman asked me the other day. She had some shoulder discomfort as well as some other things, and she wanted to get back into weight training, and all she had was her home gym. I guess she could have joined a gym, but she preferred not to, and she said, hey, Dr. Charlie, can I get strong and get back in shape? It's one of my goals for 2020 without having access to all this fancy equipment. So I want to talk a little bit about sort of how that conversation went, as well as some tips and tricks to get stronger without injuring anything this year. So with that being said, call 484-552-3767 with any specific questions. I help people get back to normal, get back to the gym, things like that without pills, injections, or surgery. So I have some little notes over here so I don't miss anything. But basically, here's sort of how the conversation went. So absolutely, yes, you can get stronger with just using, say, body weight exercises or light weight things you might have around your house if you don't have a whole personal gym or something like that. And you can gain comparable strength to that of somebody who goes to the gym and has access to heavier weights. So there was actually, and by the way, this isn't my opinion, this is based off of science. So there was a research article that came out recently in the past couple years in the American Journal of Sports Medicine that looked at and compared people who went to exercise without weights or heavy resistance, just using body weight, and then people who used resistance, so in the gym, using external loads or things like that to improve strength. And what they found is that at the end of basically a 12-week program, the strength gains were pretty much similar as long as they did this one thing. So the one thing that both these programs had to have in common that needed to be present in order to result in improved strength was that they had to go to fatigue. So meaning get that strength training and just anything in life happens when you're challenged, when you're pushing the limits, right? So there's this concept that you should understand that's called progressive overload. So it's this idea that, right, if we want to get stronger and stronger, that's what our training has to look like. So a big mistake that I see people doing, especially if they've had an injury in the past, is that they go in, I've got a weight here. So they go in, they take this weight, right, and they just start doing this. And then 3 weeks later, I see that same person in the gym, and they're still holding the same weight. And then 6 months later, they're still holding the same weight. And some of it, right, is probably just fear of, hey, I've injured myself before, I'm not confident of what I'm doing, and I don't want to set myself back. Or it's just lack of understanding about this concept. If you start with a 2-pound weight here, right, ideally, a couple weeks later, you up it to 4 pounds, to 6 pounds, to 8 pounds. So if you want to get stronger, the concept is you have to progressively increase the resistance and challenge to the system. Because if the body's not challenged, then it's not going to change. So progressive overload is the first sort of principle there. And like I said, how do we know, though, what fatigue is? So is it shuddering and having a seizure on your last repetition? No, that's not it. So what we found is that we've had various sort of principles behind strength training we've looked at, and what we found is something that works really well is rating of perceived exertion, RPE. I'll explain that in a minute, but just get that a lot of people, not only do they lift this weight over and over again, but then they've been told to do 3 sets of 10 repetitions, and they just stay there and stay there and stay there, and at 10 repetitions, they're like, I'm done. And that's it, right? So they consider that their resistance training. But number one, it's not, they never progress it. And number two, they're not fatigued. Remember I said in order to see strength gains, you don't have to have thousands of pounds. You just need to push yourself to fatigue. So rating of perceived exertion, 10 reps could be it for you, but it's this idea that you want to push yourself. If 0 is like you're sleeping, right, and 10 is like failure, very, very, very difficult, then, to make it super simple, you want to push yourself to you're about a 7 out of 10 on that fatigue scale with every set. So if you're just picking up, some light weights and you're going to 10 because someone told you to go to 10 reps, well, that's not going to do it. So you want to push yourself to where you feel like it's a 7 out of 10 on the difficulty scale. And then you might be saying, well, Charlie, is there another way to sort of think about that? I can't figure that out in my brain. Yeah, work until you have about 3 reps left in the tank. So, you're doing it ooh, without breaking form, and you're like, I could probably do 3 more, but that's about it. Then stop there. So stop at that about 7 out of 10 on that rating of perceived exertion scale. And what's nice about that is it's your perceived exertion. So my perceived exertion is going to be different than someone else's. So you can totally customize this to your needs. So right there we've got progressive overload. We've got rating of perceived exertion, should be about a 7 out of 10 on that scale. So this means progressive overload, the weight is consistently going up there. The other thing is that we want to focus on compound, right here I guess, compound versus isolated exercises. And especially compound first. Now, what do I mean by this? So the other thing I told her is, I was looking at her program, and she would start by doing things like bicep curls, or sitting on the knee extension machine, where you're kicking your legs out, or curling your legs back, or tricep kickbacks, these different things, right? But the thing is that those exercises use very small, isolated muscle groups. So, you're just working these things in isolation, and that you're just curling and you're just working your bicep, for example, or your tricep, or your quadricep. So isolated exercises, because you're using smaller muscles, you can't move as much weight. Therefore, you can't overload the system as much. So instead, what we recommend is that people stick with compound movements, which are movements that require a lot of the body. They stimulate a lot of the nervous system and the muscles within the body. So for example, some examples here would be a push-up, or a bench press, a shoulder press, a squat, a deadlift, pull-up, or a row or something like that, right? So there are variations within this, but to be truthful, this is a really solid strengthening program if people can just stick consistently to these things. So here's sort of a little tangent here, is that people love these HIIT workouts, right? But you have to think of another concept, I guess, is going to be, I'm going to say specificity. It's a big word, but hold on. That says specificity. Of training. That says training. Meaning, what are the goals, right? So if the goal is to, be a triathlete, then yeah, you're going to want to strength training, but you're going to have to be outside, swimming and biking and doing things like that. So if you want to be a professional football player, you have to play football at some point, all right? So if you want to get stronger, you need to focus on strength training as an individual component of your health and wellness program, if you will. So a lot of people, what they do is they kind of mix it up. They say their intentions are different than that which they do. They say, Charlie, I want to get stronger. This is a bad marker. I want to get stronger, and then they go do HIIT training. Well, get this. Or they say, I want to get stronger, but I go in the gym and I do 45 minutes of cardio, which zaps a lot of our energy stores and pre-fatigues the nervous system, and then I go lift weights. So if you're going to, depending on what you want to do, in this video I'm talking about strength training, lift and only lift. And if you want, then do cardio afterwards. But you definitely want to set up something in your program where you're going in the gym, you're focusing on lifting weights, right? So it would, something like this, for her would say, hey, you're going to focus on, and there's a lot of ways you could do this, right? We found that 3 days a week is, just as good in many cases as like 5 days a week of strength training, as long as the intensity, 7 out of 10 is there, all right? And you're focusing on lifting, not pre-fatiguing yourself with other things, right? So let's just say that she does a total body workout. I'm not saying that has to be done. It could just be she does upper body, lower body, upper body, lower body, upper body, lower body, depending on what the goals are there and what she wants to work on. But let's just say she does push-ups, push, and a press, and I don't know, she's doing chest and shoulders that day, right? So she could do 3 sets, about 10, nothing wrong with 10 reps, but she needs to pick a weight that's adequate such that when she gets to 10 reps, she's at a 7 out of 10 on the tired scale. And then when she can achieve those 3 sets of 10 reps for 2 weeks, then we bump up the weight. She's not going to be 6 months from now lifting the same weight over and over again. Now, here's the thing. What if we don't have weight? So I want to go back to that whole body weight question. What we found is that, again, the common link between people who got stronger, whether they used body weight or external weights, was fatigue. So you absolutely can do body weight things such as push-ups and pull-ups and dips on the edge of a chair, or body weight squats. But the point is that you have to get to fatigue. So that means that it's going to take many, many more reps to get to a point of 7 out of 10 on the RPE scale, or on the tired scale, such that you're sufficiently challenging yourself, versus if you have an external load, you could increase that weight and resistance such that you could only do 3 sets of 10. So point is that it can be done. It's just that orthopedically it brings the body through a lot more motion, which may or may not be an issue. And so it's going to take more time generally, and I consider it a little bit more suffering, just because, you know, to do 3 sets of 50, 60, 80, 100 push-ups, if you can do that many, is just a lot of mental and physical pain there. So again, it can be done. It just has to be done to fatigue. So the big take home so far is it's got to be work, folks. You've got to work. Talk about compound versus isolated, cardio second. Yeah, and then the other thing is just like creating consistency in this. So the compound effect of just doing this, right, consistently, not just doing it once, but doing it consistently. If a 3-day split, Monday, Wednesday, Friday, is all that can be committed to, okay. If it's 5 days, okay. But the point is that it's got to be consistent. And the other thing is, I would pick consistency within the activities that are being done. And I would keep it simple. A push, a press, a squat, a deadlift, and some type of pull, like a pull-up, or a lat pull-down, or a row. You can use TRX straps. You can use a tree. It doesn't matter. They've got things that go over your door. Anything there. Because what's nice is, I'm going to erase this, is that you can see, if you start, a lot of people get frustrated and deterred from continuing strength training and just losing weight or sticking on a diet because the results are not immediate. So we know, what's an expected time frame to get stronger? Well, within the first 4 to 6 weeks, we're going to see that we feel stronger. We can do more push-ups. We can lift more weights, things like that, because it's our nervous system that adapts and becomes sort of the mind-muscle connection, if you will, strengthens there. But we're not actually going to see true muscle growth. So if we put a little ultrasound on, we're not going to see that things fatten or thicken up them. We're going to have to wait for that for about 8 to 12 weeks. So get that true changes in muscle strength might take 8 to 12 weeks. Early changes where one feels stronger, is able to push more weight and feel that they can control things better, 4 to 6 weeks, because that's when the nervous system starts to learn, if you will, and it adapts. So what I was going back to is that, a lot of people, they get discouraged again because things all happen quick. And then number 2, they can't tell if they're progressing. So, they go and one week they're doing push-ups and it's a HIIT class. So then they're going to TRX and they're doing rows. And then the next week it's not a push-up, it's a bench press. And instead of a TRX row, it's a bent over row where they're pulling a weight up like this or whatever. The point is that there's no consistency. Yeah, they're working different body parts, but there's no consistency in the exercise selection that they're doing, such that week to week they can't tell if they're able to add more weight, or they're able to tolerate more resistance, or if they're headed in the right direction and getting stronger, because it's just a cluster of things thrown at them, right? So I would say, hey, if you start with a push-up, then stick with a push-up. And you'll be able to notice, like, hey, am I able to do more? Hey, am I able to add more weight, right? That idea of progressive overload within each of these exercises, shoulder press. If we keep those things consistent, then we can actually tell, hey, in the beginning, I was able to do, 2 pull-ups, and now I can do 10 pull-ups after 12 weeks. Versus if we do 80 different ways to work the back, number 1, again, it's all over the place. But a lot of people think that's fun, by the way. They think these HIIT classes are really cool because they're just like exciting and they're new and they're kind of wild and whatever. But we found those exercises, a lot of the fancy exercises where people are getting in all kinds of funky positions in a plank while lifting their arm and doing this, we have found in research, and I have found myself, that those things just don't get done. They get done temporarily because they're cool and exciting, but they don't get done properly in most cases. So just keep that in mind, that that as much as the body craves sort of a unique way to do things, and that gets the dopamine going and some excitement there, get that a long-term program should really be use the whole KISS principle. So maybe that's another take home. Keep it simple, stupid, versus all this fancy stuff is where people, they injure themselves because they're not sure what the heck they're doing. They can't stay consistent with it. There's just too many variables, and there's too many options for exercise choice. So I would just keep it simple, because we know this works. Push up, shoulder press, squat, deadlift, pull up, or some type of back movement there. And by keeping things consistent and going by the KISS principle, we can tell what's working, how we're able to overload this thing if we're going in the right direction. We can get consistent with a program, because we know that once we start, we know what the heck we're doing. A big thing is people love these group training classes a lot of times, and because at least the feedback that I've gotten is that they don't want to think about what to do while they're in the gym, right? They just want to have someone tell them what to do. But what's cool about something like this is, if you can get over the mundaneness of it all to some people, is that you can see results, you can track it, because you're staying consistent with things, and once you learn the motions, you just load it up. You continue to load it and progress it. Most folks that I work with are confused by the chaos of going to PT or going to a trainer or something like that and getting all kinds of different exercises. Again, fun and exciting, but then they're like, I don't know if I'm getting anywhere. And what I do is rather than doing more with people, I tend to do less with people, pick the top 1 to 2 to maybe at the end of the program, 3 things that they know they can do, and we progress through. Such at the beginning, they know, wow, I could lift 25 pounds with this, and now I can lift 75 pounds, right? So they can see a change there. So hopefully that makes sense. Just get... maybe I'm missing something there, but for anybody out there who's it's 2020, you're trying to get stronger. By the way, the evidence is super strong for strength training. In fact, there was an article that just came out that talked about retiring flexibility and stretching altogether, and that we've seen no changes in injury reduction or anything, no changes in mortality, no changes in overall resiliency and injury risk with flexibility training. So not to say there's maybe not some component there, but it doesn't improve the body's capacity to do work. It doesn't challenge the system enough such that we can grow. So with that being said, anybody's looking to strength train, you absolutely can do it with body weight. But body weight exercise, you're going to have to do a heck of a lot more. And so that means you're going to have to bring the joints through a lot more motions and things like that. It's going to take more time versus resistance training, right, where you can more quickly get to the challenge point, which is no matter what you're doing, body weight or not, you want to push every set to about 7 out of 10 on the difficulty scale, meaning that you've got 3 reps or so left in the tank until you're completely toast. We want to start, if our intention is to get stronger, we want to do cardio after the strength training so we don't tax the nervous system and reduce the energy stores there. So we want to lift first and then do cardio if we're going to do cardio at all. And then we're going to start with the big motion. So there's nothing wrong with bicep curls per se. Again, it depends on what your goal is, but instead focus on big motions that work not only the biceps but the back and the shoulders and the belly and the whole system, right? We're trying to boost resiliency of the whole system, not just the arms. So compound movements such as push-ups, presses, squats, deadlifts, pull-ups to start with, and then we can go, from push-ups and do some tricep kickbacks or things like that. Every week, once we can get, say, 3 sets of 10 reps, I have nothing wrong with 10 reps. You just need to be at a point where 10 reps is really challenging. Once we get at a point where we can do the same weight, 10 reps at a 7 out of 10 for 2 weeks, and it gets easier and easier to where, hey, I'm getting to 10 reps, or I'm getting to 12, 13 reps before I reach that, then it's time to boost up the weight. I found that we can boost weight for the upper body about 5 pounds a week, for the lower body 10 pounds a week. So tack on some weight there, and keep it simple, stupid. So a lot of people want to go fancy with all kinds of cool exercises on YouTube and Instagram nowadays, but we know that the tried and true exercises that work big muscle groups that really stimulate hormonal changes and a lot of growth and challenge the system sufficiently: push-ups, pull-up, squat, deadlift, and some type of pull-up exercise, something like that. So find what you can be consistent with, and Happy New Year, everyone. Wishing everyone can get super strong this year. Stop stretching, start strengthening. Call 484-552-3767 if you need any help with programming there, and or you're trying to do it around some type of ache, injury, or pain. Thanks.